wash my hands. Hi, my name is Natalie Oliverio. I'm a physician assistant, and I'm here to do your physical exam. First I'm going to check my patient's mental status, her orientation to person, place, and time. Can you tell me what your name is?
Jane and Kyle.
Can you tell me where we are?
The PA lab.
And what's today's date?
October 10th.
Alright. I'm also going to be checking her apparent state of health, level of consciousness and state of awareness, signs of distress, posture, grooming, dress, and hygiene, affect, mood, manner, and speech. Now I'm going to check your vital signs, starting with the blood pressure. Okay, place the cuff properly. I'm going to palpate her brachial and radial arteries, pulses. And then I'm going to check for the upper limit. Upper limit is about 130. And now I'm going to check the blood pressure using the bell. Her blood pressure was 110/72, which is regular. Now I'm going to check her pulse for 30 seconds. Okay, 62 beats per minute. That's regular. I'm going to check her pulses bilaterally, and at the same time I'm going to be checking her respirations for 15 to 30 seconds. Her bilateral pulses feel about the same, and her respirations were about 16 breaths per minute, which is regular, and it was unlabored. So I checked the rate and the rhythm. Now I am going to check her gait. So would you stand up for me and take off your shoes? Okay. First, will you walk towards me? And walk back, going from heel to toe. And walk back on your tippy toes. And then back on your heels. Okay, now I'm going to do the Romberg's test with eyes open and closed for about 20 to 30 seconds. So just stand with your arms at your side and eyes closed. Okay. Now I'm going to do the pronator drift test. So put your arms out like this for me, eyes closed. And now we're going to check for fast movements. So tap your hands. touch your fingers to your thumbs. Okay, touch your nose to my finger. Okay, I'm going to do it moving. A little bit harder. Alright, eyes closed. Good. Now I want you to tap your foot and your other foot. And run your heel down your shin. Good. Now I'm going to check your spine. Can you turn around and lift up your shirt for me? I'm going to be checking for curvature and posture, and I'm going to palpate the spine. Okay. Now I'm going to check the range of motion of her spine. So can you flex your spine forward for me? Extend backwards, laterally bend, and rotate. Good. Now I'm going to be inspecting her skin. I'm going to inspect the skin in its entirety, looking for the color, any lesions, temperature, moisture, texture, turgor, mobility, and I'm going to check her nail beds and her toes and don gloves for any lesions. Now I'm going to check the upper extremities, so can you put your arms out for me? Inspect them bilaterally. I'm going to start from palpate the digits and the wrists, the elbows, the shoulders, and all the muscles in between. And I'm going to check her range of motion. So can you flex your fingers into a fist, extend them, and spread your fingers. Okay, make a fist and flex your wrist forward, extend, radial and ulnar deviation, and flex your elbows, extend, pronate, supinate, flex your shoulders, extend, abduct, adduct, and externally rotate, internally rotate. Okay, now I'm going to check the strength. Can you grab my fingers? Okay, now flex your wrist downward and extend. Flex your elbows, extend. Flex your arms, extend, abduct, adduct, and shrug your shoulders. That's checking cranial nerve 11. Now I'm going to be checking her head. I'm going to be inspecting her hair, her scalp, her face, and I'm going to be palpating her cranium, her hair, her scalp, her temporomandibular joint, and all of her lymph nodes. So the lymph nodes are the preauricular, postauricular, occipital, submandibular, submental, tonsillar, anterior cervical, posterior cervical, deep cervical, and supraclavicular. Now I'm going to be checking her eyes. So, are you wearing any contacts today?
No.
I'm first going to check visual acuity, which is cranial nerve 2. Holding this up 14 inches away from the eyes. Can you read the smallest line for me?
937826.
Okay, now can you cover one eye and do the same thing?
937826.
And the other?
429739.
Okay. And now I'm going to check her visual fields, which is also cranial nerve 2. Can you tell me when you see my fingers?
Okay. Okay. Yep.
Okay, cover one eye for me.
Yep. Yep. Yep.
And the other one?
Okay. Okay.
Okay. And now I'm going to inspect her eyebrows, eyelids, and eyelashes, her sclera, her cornea, and her conjunctiva, her bulbar and palpebral. Look up for me and look down for me. And I'm going to ballot her eyeballs and her lacrimal ducts and lacrimal glands. Now I'm going to check her direct and consensual reaction to light. Would you look ahead, straight ahead for me? This is direct and consensual. Direct and consensual. I'm going to inspect her anterior chamber with transillumination. And I'm going to inspect her eye position and alignment, which is cranial nerve 3, 4, and 6, and her extraocular movements, which is also cranial nerves 3, 4, and 6. Will you follow my light? Okay. And now I'm going to check her convergence and divergence. So that's convergence and divergence. Now I'm going to do the fundoscopic exam. So the first thing I'm going to be looking for is the red reflex, and then I'm going to identify the optic disc, the arteries, the physiologic cup, and the macula. So. Identify the red reflex, and then get closer in. Okay. Now I'm going to do the inspect the ears. I'm gonna first inspect the meatus to determine the proper speculum size. So put my speculum on, and I'm going to be inspecting the tragus and the auricle, front and back. Front and back. I'm going to palpate the auricle and the tragus and the mastoid process. And I'm going to check for check her hearing, which is cranial nerve 8. Can you tell me when you can't hear my fingers?
Okay.
Okay, can you cover one ear?
Okay.
And the other one?
Okay.
Okay. Now I'm going to do the Weber's lateralization test. So can you tell me if you can hear this equally in both ears or better in one than the other?
Equal.
Okay. And the Renee's test. Tell me when you can't hear it, feel this anymore, hear this?
Okay.
Can you still hear it?
Mm-hmm.
Okay. Tell me when you can't hear it anymore.
Okay.
Can you still hear it? Okay. Alright. Now I'm going to be looking inside the ear. I'm first going to be inspecting the external auditory canal, and then I'm going to identify the malleus, the umbo, the tympanic membrane, and the cone of light. And then I'm going to check tympanic membrane motility by insufflating. Now I'm going to move on to the nose. I'm going to inspect and palpate the external nose, the nares, and the frontal and maxillary sinuses. And I'm going to check for nasal patency. Can you cover one nostril and blow in the other? Okay, and check for your sense of smell, which is cranial nerve 1. Can you close your eyes and cover one nostril and tell me what you smell?
Toothpaste.
Yep. Okay, we're going to do the same thing with the other nostril.
Cinnamon.
Mm-hmm. to change the speculum, and I'm going to inspect the nasal mucosa, the septum, and the turbinates. Now I'm going to inspect the mouth. Start by inspecting the lips. Can you open your mouth for me? The teeth, the gums, the buccal mucosa, the hard palate, posterior pharynx, tonsils, tonsillar pillars, and tongue at resting position. Can you lift your tongue up for me? And the floor of the mouth. And can you stick your tongue out for me? This is cranial nerve 12. And say ah.
Ah.
Cranial nerve 9 and 10, the uvula and the soft palate. Now I'm going to inspect your neck. I'm going to be inspecting your trachea and your thyroid. And I'm going to palpate your trachea and your thyroid. Can you lean forward and swallow for me? Okay. Now we're going to check the range of motion of your neck. So can you flex your head forward, extend backward, laterally bend, and rotate. And now I'm going to check your strength. So can you flex forward, extend backwards, laterally bend, and rotate. Good. Now I'm going to check your posterior thorax. So can you please take off your shirt for me? Can you put your hands up like this, like you're giving yourself a hug? Okay. Now, first I'm going to be inspecting for bony landmarks and configuration and use of respiratory effort, rate, rhythm, depth, effort, and use of accessory muscles. I'm going to palpate the bony landmarks and muscles and find T7. Right there. And I'm going to check for tactile firmness. So say 99 every time I touch you.
99, 99, 99, 99.
Okay. And now I'm going to percuss in 7 points using the ladder pattern. And percuss the cost over T roll angle. Do you feel any pain with this?
No.
Any with this?
No.
Okay. Now I'm going to oscillate each of those points. Will you take a deep breath through your mouth each time I touch you with my stethoscope? Okay. Now I'm going to inspect the lateral thorax. I'm going to be inspecting and palpating along the mid-axillary line muscles. And I'm going to percuss 2 points. And auscultate. Can you do the same thing as last time? Deep breaths each time. Okay. And now the anterior thorax. I'm going to be inspecting for configuration and bony landmarks, especially the sternum, the ribs, and the clavicles. and I'm going to be inspecting for respiratory effort, rate, rhythm, depth, effort, and use of accessory muscles. I'm going to palpate the clavicles, the ribs, and the sternum, and find the right fourth rib. Right here. And now I'm going to check for tactile firmness. So can you say 99?
99, 99, 99.
Okay. And I'm going to percuss. So and oscillate, so deep breaths every time, just like before. Okay. And now we're going to do the chest exam. So can you lean back at a 30-degree angle here? First thing I'm going to do is inspect the carotid pulsations, in the neck veins, and I measure the JVD. Which is about 5 centimeters, which is normal. And I'm going to be inspecting the precordium and the PMI and the cardiac points, or PMI heaves and pulsations. And I'm going to palpate the precordium, the 4 cardiac points, and the PMI, and the carotid. So and then I'm going to oscillate all 4 cardiac points, first using the diaphragm. So the first one is the second right intercostal space, second left intercostal space. Can you please displace your breast for me? 4th left intercostal space at the left sternal border. 5th left intercostal space at the mid-clavicular line. Then I'm going to do the same thing with the bell. So this is aortic, pulmonic, tricuspid, and mitral. Now I'm going to auscultate the carotids. Can you hold your breath for me? And that's using the bell. I'm going to auscultate the apical impulse using the bell. Can you roll over on your left side for me? Okay, that's checking for mitral stenosis. Now I'm going to correlate the apical and peripheral pulses. They seem to be about the same. Can you sit up for me? Using the diaphragm, between the 4th and 5th intercostal space at the left sternal border, I'm going to be checking for mitral regurgitation. Can you lean forward for me, exhale, and hold your breath? Great. Now I'm going to move on to the abdominal exam. So I'm going to have you lay flat, supine with your arms by your side. There we go. Arms by your side and knees bent. First, I'm going to inspect all 4 abdominal quadrants and the epigastrium, and then I'm going to auscultate them. So, this is the right upper quadrant, left upper quadrant, left lower quadrant, right lower quadrant, the epigastrium, abdominal aorta, the renal arteries, and iliac, okay. Now I'm going to palpate or percuss for livers, each of the quadrants, in the epigastrium, and I'm going to check the span of the liver. Okay, can you hold this here for me? Okay. Okay. It's about 5 centimeters, normal. And palpate the spleen for any gross enlargement. Okay. Now have you been feeling any abdominal tenderness lately?
No.
Okay, I'm going to palpate. First, I'm going to palpate all the abdominal quadrants deep, and then, or soft, and then I'm going to go a little bit deeper. So soft. And the epigastrium. A little bit deeper. Okay. Now, palpate your liver. Can you take a deep breath for me? And exhale. Okay. And spleen, deep breath. And exhale. Can you roll over onto your right side for me? I'm going to do the spleen one more time. Deep breath. Exhale. Okay. And back on your, lay on your back. Okay. Kidneys. And then I'll also be palpating for the femoral pulses and inguinal nodes. And I'm going to check your rebound tenderness. So can you tell me if it hurts more when I push in, let go, or not at all?
Not at all. Not at all.
No? No? Okay, great. Now I'm going to check your lower extremities. So can you straighten your legs out for me? Okay. First I'm going to inspect the lower extremities bilaterally. I'm going to palpate the digits, the ankles, the knees, and the hips, and all the muscles in between. Feel for the dorsalis pedis pulses and the posterior tibialis pulses. Can you bend your knees a little? Popliteal pulses. And now I'm going to check her legs for flexion, hip flexion, extension, abduction, adduction, internal rotation, and external rotation. Same on this side. Hip flexion, extension, abduction, adduction, internal rotation, external rotation. Now I'm going to check your strength of your hips. So can you flex your hips upward, extend, abduct, and adduct? Great. Can you sit up for me? Now we're going to do your knees. So can you, we're going to extend your knees out forward and then flex them back towards you. Okay, and check your strength. Extend and flex. Now I want you to plantar flex your toes like this. Dorsiflex, invert, and evert. Okay, I want you to plantar flex. Dorsiflex. Good. And now we're going to check ankle clonus, or reflexes. So first your brachioradialis. So can you relax your arm for me? That's C5 and C6. And relax. And the bicep C5, C6. Alright, I'm going to do your triceps, C6, C7, C8. Alright, patellar, I'm going to push this in. This is L2, L3, L4. Okay, and Achilles S1, S2. And plantar, which is S1, S2, L4, L5. Now I'm going to check your ankle clonus. Now I'm going to check your position sense. So this is up and this is down. I want you to close your eyes and I'm going to do this. I want you to tell me whether it's up or down.
Up, down, up, down, up, down, up, down.
Okay, now this is check your vibratory senses. This is vibrating and this is not. I want you to tell me if you feel it vibrating each time. Close your eyes.
Okay. Yeah. Yes. 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 Yeah.
Okay. Now I'm going to check your soft sense. This is what it feels like. Soft. Just tell me every time you feel it. Can you close your eyes?
Yep. 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 Yes. Yes. Yep. Yep. Yep.
Okay. Now this is sharp and this is dull. I'm going to you to tell me whether you feel sharp or dull.
Dull. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Sharp.
Okay. Now I'm going to check your spheriognosis. Can you close your eyes and tell me what I'm putting in your hand?
Quarter.
Good. And I'll wash my hands and pass physical exam.